Hello, everyone. This is Jennifer Whalen,
And I'm Melissa Cardine.
and we're the founders of the Bridge Health Advocates. We are here to tell you a little bit about ourselves. We thought it would be a good idea to give you a little bit of our background and how we were led on this journey to health advocacy. We also want to tell you a little bit about our business, the Bridge Health Advocates, and just help you get to know us a little bit more and all that we have to offer. So since you've gotten to this video, we know that you definitely have some type of interest in health advocacy, patient advocacy, or maybe the Bridge Health Advocates. So we really hope you get to know us a little bit better, and eventually maybe we get to know you guys a little bit better too. So thanks for watching. But we're going to start with Melissa and just have her talk a little bit about her nursing background, or all of her background that kind of has led her to where she is today. So Melissa, do you want to talk a little bit about what you've done for work or education or anything, all of the above?
Sure. Yeah, absolutely. Thanks. So I have been a nurse for 24 years now, quite a while, and did a very traditional type of nursing in the hospital, outpatient, managed an outpatient treatment center where we did infusion therapy, wound ostomy, and a bariatric center, and managed that outpatient and the inpatient side of those fields of nursing. So pretty traditional nursing. Went and actually did my master's early on in my nursing career, only 5 years after getting my bachelor's.
Wow.
And yeah, early. And back then, this is actually what I wrote up, is patient advocacy. But back then, there actually wasn't patient advocates. So the only thing similar to what I envisioned I wanted to do was geriatric care management.
Okay.
So I wrote up starting a business, doing private advocacy work back then. And I actually named the business after my grandma, called Sophie's Choice. And to be honest, when I finally, launched and this all came to fruition, my husband said, honey, you might want to Google Sophie's Choice because I don't think you want to name your business that. So, but she was really my inspiration for what I really envisioned doing as a nurse. And again, this was only 5 years into my nursing career. And I really knew even by then what I enjoyed doing. And honestly, it was really listening to patients and spending time with them. And unfortunately, our traditional healthcare system and our roles don't always allow that. But fast forward, it's good that I didn't start my patient advocacy business until later, because honestly, I did need more professional experience and life experience that now, helps me help others.
Well, that's great. That's wonderful. It sounds like a great journey. And I completely understand that, working in kind of traditional medicine and in hospital systems, how you just feel that, am I doing all I can? I wish I had more time to sit and listen and really dig in to what's going on in, our patients' lives and really figure out what's going on. So that's, yeah.
Why don't you share a little bit more about your background?
Sure. So I started out a long time ago working as nursing assistant, in nursing homes, and then as a medical assistant in clinics and family practice, that kind of thing. And I eventually went to PA school, graduated, way back in 2004, and then worked in a few different kind of primary care areas, urgent care, family practice, and then worked as a hospitalist for a while as a physician assistant. And it's great. I definitely loved, doing that kind of clinical work, but the same as you, I just felt like, there was something missing. Were we really helping these patients the way that they needed to be helped? And I went on to do some more schooling. And same as you, had this idea, and I think I called it a healthcare associate. I didn't know that patient advocacy existed. Wrote it up there, and I based them in like a family practice kind of location. That was where I put that
Oh,
career.
yeah.
But the same type of things that advocates do today, those are the job tasks. And of course, I thought I was creating this profession in my mind. Well, this wasn't, gosh, not that many years ago. But I think we just all come to this very organically. We have these experiences and just know that advocacy needs to exist and the public needs to be aware of it. Um, and then, was getting another degree and had just moved out to Arizona. And that's when my sister, who knows Melissa, kind of got us together. And I started helping her out at the Bridge RN, which is Melissa's patient advocacy business, where she's providing, direct patient advocacy services to clients. Do you want to tell us how you, I guess, when did we get together? November of something, 2018?
Yes. And I started the Bridge RN in the fall of 2015
Mm-hmm.
is when I started. And to be honest, I was working in the hospital part-time. And there was just something that was tugging at me that there was something more I should be doing.
Mm-hmm.
And I just did it, to be honest. I was like, this is what I want to do. And I started telling everybody I know that I was going to be a patient advocate. And people looked at me like, what are you going to do? I mean, even a lot of my friends and my family, but I really led with my passion and what I knew I wanted to do. And I mean, it's really sort of simple. I wanted to help others. And I knew to truly help others that I needed to listen to them.
Mm-hmm.
And I needed to hear their stories. And then as you're listening to their stories, I knew that I wanted to provide them education and resources so they can make the best decision for themselves.
Mm-hmm.
I was just getting tired of working in that role where I felt like I was doing that at times, but then I only had so much time, or I would work and the next day I'd go back, they weren't there. So, they were already gone. And it's like, well, how do I follow up on, the work I did the day before because they're now at home? And it's that whole big picture. And I wanted to work with people no matter if they were in the hospital or in a rehab or assisted living or at home alone or home with family.
Mm-hmm.
And so in 2015, I started the Bridge RN Patient Advocates. And through my passion, telling everybody, honestly, I started to get clients. And slowly, in 2016, it started to grow, 2017, and then I needed help. And that's when we found each other, to be honest, is I was looking for a nurse and an office coordinator, and you were able to fill both of those roles. Is mainly I was looking for another advocate to go out and see clients for me, and then to help the business and run the business.
Yeah. Yeah. And that was, just really fortunate. Again, I was going to school at the time and I thought, this sounds like a great opportunity. Let's explore this. So it was just phenomenal, meeting you, learning from you how to work as an advocate, and just seeing everything that makes you so successful, what you do for your clients, and I just thought that was phenomenal. And then from there, it kind of just bloomed. I mean, tell us about, it really was Melissa's idea of, this creation of the second business, the Bridge Health Advocates. So tell us a little bit about how that started and where that, I mean, you had a really you have currently still.
Yeah, I
Really
still see.
successful
Yeah.
business, working as a patient advocate, but there was something more that you wanted to do.
Well, to be honest, it's like I'm one person.
Yeah.
So it's like, well, how do I help even more people? I can only personally help. As a patient advocate, you can only handle so much, so many clients at a time, so many cases.
Mhm.
And I just knew there needed to be more people out there, being patient advocates. And, unfortunately, people need us.
Right.
And so I was like, well, how can I have other people who have similar backgrounds and education and experience
Mhm.
that have the same passion as I do? How can I help them, do what I do? And so that's what I shared with you. I'm like, Jen, we need advocates all across the country doing this in all areas.
Mhm.
And so I shared that with you, and I think you were excited about that.
Absolutely. Right from the get-go, I was like, yes, this is what I want to do. Let's start something here, get as many advocates as we can out there working and doing it the right way, really starting a business that they're going to find very meaningful for them, that's very personalized, where they're doing the work that they've always envisioned, you know, um, themselves doing.
Well, and
So,
I knew that in order to get more advocates, we needed to set them up so they could either leave their job,
mm,
or they can make an income as a secondary job. And so I wanted, to create something where it's like, oh, they can make a plan, like just sort of like I did. Like I wanted to leave the hospital. I wanted to leave that traditional role, but it's very scary
yeah.
when you're used to getting a paycheck every 2 weeks and doing that and then going, now how am I going to do this? It is scary. So, but I went through it, and I was like, I know I can share this with other people, how they too can do this over time
Mhm.
and be successful.
Yeah. Oh, yeah. I just love what we do. I mean, I really
So
do.
do
I
I.
love,
I know. I
talking with everyone who's new to advocacy, wants to start a business or, practice as an advocate. It's just great. Everyone has really unique, stories that really fuel their passion for this field. So I think we're really lucky, to be able
Yeah. And
to.
again, in a sense, like, being a patient advocate, we enjoy listening to our clients' stories and their families. But now you and I, we really enjoy listening to other professionals and their stories and their backgrounds and their passion, and then helping them create something that's going to just bring them joy.
Yeah.
That every day they get up, they want to go to work, and that's priceless. So we're very fortunate. We have both aspects where we're actually helping clients, and then, now we're helping other professionals, do what we love to do.
Yeah. Yeah,
Yeah.
absolutely. Well, I think we've covered a good amount in this short time. So I hope everyone has kind of gotten a little bit of sense of who we are, kind of what led us to, this career and down this path of um, health advocacy. So feel free to reach out to us anytime. You can find us on our website, send us an email. We're always happy to hear from people who are curious about advocacy or
Yeah.
are working in the field of advocacy. Anything that we can do to help. And we really hope that reach out to us and we get to know you.
Yeah,
And
absolutely. Reach out to us and feel free to share your story with us. If you have an interest in advocacy, feel free to just shoot us an email and tell us a little bit about your background and your thoughts about being an advocate. And we would love to hear your story and have a conversation with you.
yeah, well, this has been nice.
Yes.
Thanks, Melissa, for
Well,
sharing all your
you too.
background. All right, everyone, take care.